Before going for surgery, it is important that you meet the anesthetist. The anesthetist will evaluate you, will ask you a few questions to see whether you're fit for surgery. He will ask you whether you have any long-standing comorbid conditions or diseases such as hypertension, diabetes, asthma, tuberculosis, any heart problem, a previous stroke, or even issues regarding the thyroid, whether you have hyperthyroidism or low thyroid hormones in your blood. So all of this can affect anesthesia. This will decide on how easy or difficult the course of surgery is going to be. And what is most important is the test that you do before surgery, because that will tell us your status, your health status, and the status of whatever pathological process that you have, and to what extent it might affect anesthesia or might affect surgery. So the test that we anesthetists generally ask are a few blood tests as well as a few radiological tests and the ECG. The blood test will include a complete blood count, which will tell you the level of hemoglobin in your blood and will indicate whether we have to give you blood during the surgery in case there's going to be a lot of blood loss, or if you have anemia, this will compensate for the blood loss during surgery. And hemoglobin is important for you because it will impact how fast you can heal after surgery. And it denotes the amount of oxygen that's being carried in your blood. So if the amount of oxygen is less, that means the amount of oxygen delivered to your brain and to your heart as well as your vital organs is less, which is why the complete blood count is very important. The complete blood count will also have the platelet count, which will tell you how fast the blood clots in case when during surgery, when there is bleeding, how fast the blood clots is important because this will affect how quickly the surgery can get over and how well you will heal after surgery. The other set of blood tests is the renal function test. So this contains creatinine and urea. Creatinine will is basically a breakdown product of protein, which will tell you how fast and how easily, how efficiently your kidneys are working. This is important for us because the anesthesia drugs that we give or any other drug that has been given to you will be excreted through the kidneys. So if the kidneys are not functioning well, then the anesthesia drugs remain inside the body and circulate further, which causes the anesthesia to be prolonged. And during anesthesia, we give you fluids to rehydrate you to compensate for the amount of fluid that is lost and blood that is lost. And the other two electrolytes, as they call it, are sodium and potassium. Sodium and potassium are important for us because sodium denotes the level of electrolytes that is inside your body, which indicates how well your body can metabolize sodium. It denotes the electrical conductance of impulses in your body. And sodium that is too low or too high can indicate that either your kidneys are not functioning well or either there's been some amount of loss of fluid in your body and can then affect your sensorium, that is your mentation. And it is important for us because it will tell you how well you can recover after surgery. And potassium is important because it is a key component of the functioning of the heart. So, in case the potassium is too less or potassium is too high, then the functioning of the heart can be affected. And there can be certain incidents that can happen which will affect, which can threaten your life during surgery. The other investigation is a chest X-ray because it will tell us how clear your lungs are, whether you have any infection in the lungs or whether there's something that hasn't been picked up before. And it will give an indication of how your heart is as well as the lung tissue. So for people who are quite fit and we can auscultate and find out if your lungs are functioning well, then it's okay. But for people who are a little older and have a few other conditions, respiratory conditions with them, let's say who have a pneumonia or who have asthma or who have chronic obstructive pulmonary disease, then it's important for us to assess how badly the lungs are affected. Then the other investigation is the ECG. So this will tell us whether your heart is functioning well. It's functioning, it has the right rate and rhythm, and it indicates to us whether some chamber of the heart is enlarged. And it will tell us whether it's functioning at a periodic intervals and it's not too fast or not too slow. So this is an indication for us to decide whether you will need an echocardiogram, which will give us a lot more information about the heart, that is, the chambers of the heart and the valves of the heart, the functioning, or whether the heart is pumping out enough blood to all the tissues and the organs. So, an echo is something that we would generally ask if we know somebody is not being able to function well, as in to do their household activities or to be able to walk about 2 kilometers without feeling breathless or not being able to climb stairs easily. So that is when we would consider to do an echocardiography for you. And beyond the ECG and the echo, there are clotting tests, basically coagulation tests, which tells us if the factors of coagulation are within the normal limits and are working efficiently so that the blood clots well during surgery. So, like I've mentioned, if we just have to check whether your heart, your lung, your kidneys are functioning well, we will assess you. And in case you have had some sort of a liver issue previously, then we would do a liver function test to see how badly your liver is affected. Which is why it is important that you explain to the doctor all what you are doing, or if you're taking any substances, it's better to be upfront and be honest to your doctor. And let's say you have a thyroid issue, whether if your thyroid, you're taking thyroid tablets and you have hypothyroidism where there's not enough thyroid hormones in your body, then we will do something known as a thyroid function test, which will tell you the levels of thyroid hormones in your body. So let's say you have hypothyroidism and you're taking tablets and your the thyroid levels are not within normal limits, then the recovery from anesthesia can be delayed. And in case you have too high hormones that are going on in your body, then that could affect your heart and that could affect, that could cause a few critical incidents to happen during the surgery. So it's better to optimize all of these and to bring these under control so that your surgery goes on well.